Hi friends, so this is a small instructional video on how to use the contrastor set from Dentessa. So now when you receive the set, you will receive them with a film attached to it like this, which is a brown color film which is attached on both the surfaces. What you're supposed to do is just peel off this protective film like what I'm doing here so as to reveal the actual surface of your contrastor. Okay. So now once you have removed the protective film from all your contrastors, you are ready to use them. Your contrastor will have two surfaces. If you look at it closely, there would be a matte surface, which is the actual contrastor surface, which we will use for our dental photography. And then it will also have another surface, which is a shiny surface. Let's work first on the matte surface. Now, this is an upper anterior contrastor. As you can notice here, it has a palatal extension. If we are doing upper anterior aesthetic work, you will use this palatal extension to place the contrastor towards the palate, and you will get a good black background for your photographs. This is how you will be using the black contrastor. This is a similar contrastor but of a smaller size, which you can use for your upper anterior shots or also for your lower anterior shots. As you can see here, it has two dimensions. So if this dimensions is too much for your patient, you can just invert it and use it this way, and this will be much more comfortable for your patient. Now the last and the third contrastor is basically a lip retractor. If you notice, all its four sides are usable sides, out of which two sides have this notch, which is typically made to accommodate the frenum, because if you use this side and the patient's frenum is getting impinged on this, it will give rise to pain to the patient. Now, if I just want to show, if you can see, this is the place where the frenum would be. So you can just adapt this contrastor here as to retract it, and you can take your occlusal shots like this, which will give you very beautiful occlusal shots. You can invert it and use the different surface depending upon the dimensions of the patient's oral cavity. As you can see, this is a bigger side and this is a smaller side.